Thank you for joining us tonight for Mood and Mental Health, How to Deal with Feeling Different. This webinar is brought to you by Can-Do Multiple Sclerosis. My name is Laura Allen, the Associate Director of Programs at Can-Do MS, and I will be your moderator this evening. So our speakers this evening are Megan Beyer and Pilar Pohl. Megan Beyer is a psychologist specializing in multiple sclerosis at Johns Hopkins. In addition, she founded FindEmpathy.com, which is an online directory to help patients with medical conditions find specialized mental health providers. She is a speaker and a consultant for several MS organizations, and overall, her goal is to help break down barriers for accessing mental health care for people living with MS. Welcome, Megan. It's good to see you.
Thank you for having me.
And also we have Pilar Pohl. Pilar is a licensed psychologist with a clinical focus on adjustment to medical illness and disability, health psychology, and life transitions. She has worked in several rehabilitation hospitals and medical centers in Pennsylvania during her 30+ years of clinical work. She currently provides consultations and training for health organizations and has a private practice in Wayne, Pennsylvania. Welcome, Pilar.
Thank you. Thank you. Happy to be here.
All right, so before I turn this meeting over to Megan, I'm going to start with a polling question. What mood changes do you experience most frequently in connection to your MS? The choices are grief, contentment, anxiety, irritability, depression, and if you have an other, please use the question chat box to share that with us. I know I'm seeing that someone wrote in the chat box, my mobility is very limited. How do you get over feeling like you're only existing and not living? Somebody else answered tiredness. And then we have grief for all the things MS keeps taking from me. And then how does MS cause depression and anxiety through physical damage? And I think that's more of a question, and we will have time for questions and answers shortly. But here's the results from our poll. Megan, did you have any comments on that?
Yeah, absolutely. It's really interesting. It looks like the two biggest contributors are anxiety and depression, and irritability falls in there. And that's interesting because irritability kind of pulls in both anxiety and depression, and we're going to talk about that in some of our slides. But I also like to see that some people did have a feeling of contentment, and we're also going to talk about that it doesn't just have to be about negative emotions. So this is a good mix.
With that, I'm going to ask Megan to touch base on our learning objectives for tonight.
Okay, thank you so much, Laura. I think this is going to be a really interesting webinar tonight, and I'm really excited to do it with Pilar. So our learning objectives are to recognize mood changes, such as healthy grieving, anxiety, and depression, to understand the importance of routine screening of mental health conditions or mood symptoms, and then learning some strategies for managing mood, such as talk therapy, medications, or physical activity, and we'll go into more detail. So we wanted to start off with just an example of a vignette. And so in this made-up vignette, all of ours are made up, we have Sarah, who's 47 years old, and she lives with relapsing remitting multiple sclerosis. Sarah started off having a bad day. She didn't sleep well last night due to a urinary tract infection that kept her getting up and down all night and interrupted her sleep. The UTI plus that bad sleep is leaving her feeling tired, fatigued, and frustrated about having to see the doctor again. She's really tired of having to deal with all these symptoms that MS is bringing on. However, by the end of the day, she's feeling a little bit better. Her wife helped by calling the doctor and was able to pick up the antibiotic prescription that she needed. And this gave Sarah some time for a nap and some extra rest. And so Pilar is going to take over here and talk a little bit about some of what we just described in that clinical case.
Mm-hmm. Yeah, so thanks for having me here today. I'm happy to share some information about moods and mental health. I know it's an important topic for all of us. And I think that that's one that has a special interest for people, since we seem to sometimes feel that mood can really make symptoms of MS and how you feel about your MS worse. We all experience bad days, right? It's normal. And even healthy, right, to sometimes have this uncomfortable emotions, and it only become problematic when they stick around, when they really stick around most of the day, for days at a time, or for weeks or months, and when they interfere with our lives. They can interfere with activities that we want to do, with some of our responsibilities. They can interfere with our relationships, and sometimes it makes us feel like we are feeling a little bit out of control. So one of our goals today is to help you differentiate between these emotions that can be normal and some of the moods that you may experience at times that maybe might require a little bit more attention and possibly treatment. So these are some of the common emotions associated with MS. They're really also just associated with being human. You know, they're just human emotions, and we all experience them regularly. And they're really not necessarily a sign of mental health problems. They're just common emotions that human beings experience. Irritability, well, sometimes it's associated with feeling impatient, easily excited. Some people describe it as having sort of like a short fuse, you know. And we can all feel irritable at times if we're tired, if we didn't get enough sleep, if we're in pain, if we're hungry. There are all kinds of reasons why we can feel irritable sometimes. We also feel frustrated sometimes. You know, we feel annoyed, upset. When things don't go our way, the way we expected, the way we anticipated, we can be a little bit quicker to anger. And as long as we don't get stuck in that feeling of frustration, it tends to be a transient emotion. The same with sadness. Sadness is a normal feeling. It tends to be temporary. You know, we don't feel typically sad constantly all the time for weeks at a time. And if that becomes the case, then that's the type of situation where some additional emotional and psychological attention might be required. But in general, sadness is a normal emotion, and so is grief. Grief is being associated typically with the feelings of loss. And I'm sure that many of you can relate to having feelings of loss associated with your MS. You know, for some of you might be loss of independence, could be a loss of mobility, loss of a job, loss of expectations about the future, a loss of family roles that you cherished. It could be a lot of different losses that are associated with MS, and grieving through those losses is also a normal process. And the same with worry. Worry has to do with you know, having concerns about situations that you can't fully control. You know, sometimes we worry about the future. We worry about certain uncertainties. And in the case of MS, there's certainly a lot of factors that are contribute to having this feeling of uncertainty, unpredictability of symptoms. And worry by itself is not really a problem unless people start dwelling on the concerns and become paralyzed and unable to function. Okay, so I think it's important to recognize these emotions that we all experience, and to be able to acknowledge them as normal emotions, which doesn't mean that we don't have to manage them. So one of the things that it's important for all of us is to to learn how to manage these emotions that we have. So this is one of our goals here, right? To help you differentiate between these normal emotions and maybe some mood changes that might require some treatment. Some of you may have heard, sometimes people talk about mood as one of the invisible symptoms, mood changes in MS being an invisible symptom, along with some cognitive changes. And it's certainly true that people can't tell how you feel unless you tell them sometimes. But I think that it can be invisible, not just in terms of not being recognized by the people around you, but sometimes it can also be invisible in the sense that it does not get communicated to your healthcare team, you know. And because of that, sometimes it doesn't get reported, those feelings of mood changes, and it can be underdiagnosed or undertreated. Today, we're going to pay special attention to two types of mood, depression and anxiety. And we're going to describe you the symptoms so that hopefully you can learn to recognize the symptoms and seek treatment if it becomes necessary. Next slide, please.
So on this next slide, we're going to share another case vignette, and I want you to kind of pay attention to maybe how this one is a little bit different than the first one. In the first one, I'll just highlight that, you know, she was having some negative thoughts, she was having some negative emotions, but they sort of dissipated throughout the day as she was able to get some rest and support from family members. Eli, on the other hand, is a 62-year-old individual who lives with progressive multiple sclerosis. Ever since he left his job, his mood has been declining. He started off feeling angry and irritable at his employer for encouraging him to retire early. And due to financial pressures, his planned dreams for retirement, traveling, hiking, really started slipping away. And on top of that, he started feeling like he was kind of a failure and feeling like he had let his family down and let himself down, quite frankly. And so these days, he just feels like staying in bed, doesn't even care about the end of his favorite TV series, and he just feels like life is hard. So if you can notice that, and then Pilar will talk a little bit more, dive into a little bit of the deeper details about why this is different than that first story.
Yeah, next slide, please. So thank you. Yeah, I'm hoping maybe during the Q&A we get to contrast these two because I think it definitely has a different feel, right, than the first case that Megan described. This is a list of the most common symptoms of depression. I'm going to quickly just read through them, and then we'll talk about it a little bit. Feeling down most of the day, nearly every day, increased irritability, loss of enjoyment or interest in activities that one used to enjoy. Sleep disturbances can go either way, either oversleeping or not, or having difficulty sleeping with insomnia. Appetite changes can go either way also, overeating or undereating and losing weight. Fatigue or loss of energy, difficulty concentrating, sometimes difficulty making decisions, feeling guilty or worthless, and sometimes having thoughts of death or suicide. So this is the diagnostic criteria for depression. And if you look at the symptoms, you'll probably see a few of these symptoms that overlap with MS, right? There's several of those: fatigue, changes in appetite, loss of interest, irritability, difficulty concentrating. A lot of these could be both symptoms of MS or symptoms of depression. Sometimes people try really hard to differentiate, you know, is this depression or is this MS? And as we'll talk a little bit more later, there is a lot of overlap. So I think it becomes more important to recognize the symptom. There might be slight differences. For instance, in the case of fatigue, when people are their fatigue is caused primarily by their MS. They tend to report being more tired as the day progresses, so more tired in the afternoon. Whereas sometimes if the fatigue is caused primarily by the depression, people might not even be able to get out of bed in the morning. But the important thing is that to recognize the relevance and the significance of these symptoms. And in order to someone be diagnosed, they experience at least 5 of these symptoms most of the time, most of the day, for at least a couple weeks. And they really interfere with their quality of life, right? Their ability to function at home, their ability to function at work, to take care of their families, their social responsibilities. They can interfere with their self-care. And sometimes they can even interfere with their compliance with their MS treatment, right? Of doing the things that they need to do in order to manage their MS. What we do know is that depression, it's about 3 times more common in people with MS than in the general population, and up to 50% of people with MS will experience an episode of major depression in their lifetime. The incidence of suicidal thoughts and suicidal behaviors, it's also significantly higher among the MS population than the general population. So if we try to look at a little bit, what are the causes of the depression? Most people initially tend to think about, of course I'm depressed because MS has robbed me from a lot of things that I value in my life. So initially people sometimes think about depression being a reaction to having MS. But we have seen that, yes, people have adjustment challenges and have to cope with all these losses associated with the MS, and that can certainly contribute to depression. But we also see that sometimes depression is more frequent in people with MS than people who have similar levels of disability. So it appears that maybe something else is going on. And maybe some of the changes in the brains of people with MS may be contributing to their depression. So in that sense, we can think about depression, being a symptom of MS, And we know that people with MS who have more lesions in the frontal or temporal areas of their brains tend to have increased incidence of depression. We also know that there's links between depression and MS, and also volume loss in certain parts of the brain, like the hippocampus or the frontal or temporal areas also, and decreased connectivity between some different parts of the brain also seems to be associated with increased rates of depression. So the important point here is that there is an association between MS, inflammation, and depression. MS can cause depression, but we also see patients with depression who have more severe symptoms of MS. And we sometimes even see that treating depression can actually improve the MS symptoms. Just to touch briefly on the medications, some of you may have been on steroids to treat either flare-ups or exacerbations, and you may have noticed that maybe you have become more irritable or a little bit more reactive emotionally. We also know that people with histories of depression can be at high risk of becoming depressed when they are on interferon. The newer DMTs do not seem to be associated with that increased incidence of depression. Next slide, please.
Okay, so we're going to transition to talking a little bit about anxiety. And, there's been a couple of questions I've been noticing in the chat box about anger and irritability. And we can certainly dive into that in more detail during the question and answer session. But I just wanted to comment on that as we're talking about depression and anxiety. And I'd love Pilar to jump in and share her thoughts. But, I sometimes think about anger as a protective emotion, and that many times behind anger, there is a vulnerable emotion. So there may be symptoms of anxiety or there may be symptoms of depression. So if somebody is feeling particularly vulnerable or at risk, then sometimes anger is a way of protecting. And so if you're seeing more irritability and more anger bursts, sometimes it's helpful to kind of think to yourself or try to notice what's the soft emotion behind it, or in what way am I feeling vulnerable? And also, we kind of learn about anger throughout our lives, how to display it, or what ways are appropriate or not appropriate to display it. And so some of it's sort of kind of comes from those learned behaviors as well. So I don't know if you had any additional thoughts about that.
Yeah, I completely agree. I think I find it very helpful to think about anger being sort of the surface emotion. That's the one you see. That's the one that is expressed sometimes. But if you dig a little deeper, then you might actually identify a more useful emotion where you can really learn something about what's going on with you. You can learn something about what you need in that moment, and also how you need to take care of yourself. So my recommendation is to acknowledge that surface one, but then try to go a little deeper and try to find out what's going on.
Exactly. Yeah. So in this next case example, we have Annika, who's 34 years old and lives with relapsing remitting MS. She's always been a worrier. Some days she worries about her diagnosis and the future and what the future might hold with this new diagnosis, and it feels out of her control. Other days it feels so overwhelming that she feels defeated. She oscillates between avoiding things that trigger her, like emails from the MS Society or going out to lunch with her friends. So I often hear people saying that they don't go out with their friends because they can't keep up with the conversation, and so they sort of retreat. So she feels like she can't keep up with the conversation, or maybe she can't get her words out. And then so she oscillates from that avoidance to Googling or seeking information or trying to alleviate her fears with trying to consume information. And all of that bouncing back and forth is exhausting.
So let's talk a little bit about anxiety. Some of the symptoms, feeling nervous, difficulty controlling the worry, as we were saying, feeling irritable, having trouble sleeping because you're worrying and that wakes you up at night. You can't concentrate because you have sometimes this intrusive thoughts that keep coming back, and it's exhausting. So you feel fatigue. Anxiety is a very common symptom among people with MS, and we know that it affects approximately about 35% of people with MS, and it has a high overlap with people with depression. It's really not so much the problem. It's not so much that people worry, because as we were talking earlier, worry is a normal emotion. But it's really the inability to control that worry, the inability to turn it off when you want to, Sometimes I find it helpful to differentiate between sort of productive worrying that can sometimes help and lead to problem solving on an issue that you have concerns about, and sort of the unproductive worrying where you just kind of ruminate about something and go around in circles and and you get stuck there, but there's really no movement, no problem solving. Is just feeling stuck in this cycle of worrying. That's the kind of worrying that is problematic, not the productive one, right? Certainly, when people worry, a lot of the worries sometimes have to do with the future, right? Things that the uncertainty about the future, things that they cannot control, and there's a lot of that with MS, right? The unpredictability of the symptoms, the uncertainty about the disease course. So I think that one of the things that is helpful is to recognize the feelings of anxiety that one has, and to also to try to recognize what types of situations can trigger those feelings of anxiety. Sometimes it's helpful, I think, also to look at what are the different components of anxiety. You know, anxiety has a physiological component. You know, when we feel anxious, there's changes in the way we breathe. You know, our breathing becomes sometimes more shallow. Our heart rate can go up. There are other physiological symptoms or components of the anxiety. But the anxiety also has a cognitive component. What are the thoughts or the images that tend to trigger our anxiety? You know, because sometimes we are anxious not about something that's happening in our lives, but something that we are predicting or that we are anticipating is going to happen, but that it's not happening in this moment. And that can be a trigger of anxiety. And the other component that I find helpful to look at is the behavioral component of anxiety. What are the behaviors that we tend to do when we feel anxious, and what are the behaviors that we tend to avoid when we feel anxious? So these are just some ways to begin to think about how to understand your own anxiety, because I think the better you understand the different parts of it, the better you can try to manage them. You know, because you can really intervene at any of those levels. You know, you could intervene at the physiological level, and Megan will talk a little bit more about what are some of those options. You could intervene in terms of really paying attention to how you're thinking about a situation that is making you so anxious. Or you could really focus more on specific behaviors that you're doing or not doing. So next slide, please. So our goal, as I was saying earlier, is to help you differentiate between what are normal mood changes and what are those mood changes that maybe might require some professional help or treatment. You know, when is it important to try to seek help for mood changes? The good news is that both depression and anxiety are very treatable, but in order to treat them, we have to recognize them, right? We have to diagnose them. So the best thing that you can do to help yourself is to really pay attention and monitor your own mood. What do I mean by that? You know, just to notice, you know, how often do you experience a specific feeling? When you feel anxious or depressed, how long does that last? How severe are those feelings? How much do they interfere with your life? So monitoring basically, so the frequency, the intensity, and the duration of the symptoms that you have is going to really help you differentiate between a mood that might be just a temporary feeling, emotion that you have, and a more persistent, severe mood that maybe might require some professional help. There are some questionnaires out there that one can take that screen for different mood symptoms. Some of them take into account that overlap that we were talking about between MS and depression or anxiety, and some don't. But I think ultimately, I think what becomes maybe most important is that you really monitor your own moods and to learn to differentiate them yourself. Hopefully, anytime you go for a doctor's visit, you get asked about your mood, and maybe even screened for it there with some of these questionnaires. But if you don't, make sure you bring it up because it's important. You know, it's important, and it's definitely going to be one of the critical components of your overall treatment that is going to help with improving your well-being. Next slide, please.
So for this next one, we are going to have a poll before we dive into strategies for managing mood. So what is your go-to strategy for lifting your mood or de-stressing? So it's exercise, meditation, working with a psychologist or a therapist, or if you have other things that you do that help you lift your mood, feel free to write them in the chat box. Okay, so exercise is a huge one, and I'm really grateful that people added that one in or picked that one because there's been some studies recently that came out that showed that exercise can be sort of on par in terms of lifting mood with some of the antidepressants out there. So it's a really good one. Meditation is also good, and we're seeing lots of new studies coming out that things like mindfulness are also helping with MS cognition issues. So it helps both your mood and cognition. And then we have others who are working with psychologists or therapists, about 7% of the audience, and lots of suggestions in here. So if you, some of the best suggestions come from people that are living with this diagnosis. And so feel free to pay attention to what others are writing in the chat box, because I think they're wonderful suggestions. So next slide. So I'm going to talk more about some broad overview strategies for managing your emotions. And there have been lots of questions that are coming in the chat box that I've been paying attention to as we've been going along. And some of those questions may be a little bit more individualized. And so working one-on-one with a therapist or a psychologist can be really helpful to dig into some of the specifics that you might be experiencing. If you are like case number one, where you have some of these bad days, and maybe they last a day, maybe they last more than one day, or you have kind of these ups and downs in your mood, but they're not really extreme, then really paying attention to healthy habits can be a really good mediator or a way to moderate your mood. So I think all of these are important for anyone who's experiencing mood challenges, but these are really good strategies. We know that exercise has a big impact. When you move more, you feel better. And so, one of the first line strategies for depression is something that's called behavioral activation. And what that means is that if you worked with a psychologist, they would encourage you to start doing something that is enjoyable and that's getting you up and out. Sometimes think about depression as something that's trying to hold you in, keep you disconnected, and kind of keep you in the dark. And so you want to break that hold, and you want to be spending time with friends, doing things that you enjoy, and getting as much movement as possible. We also know that sleep is incredibly important, but sometimes you might need a little bit of extra help with sleep. But maintaining healthy sleep habits is very helpful. Managing your diet in a healthy way that's not restrictive or overly restrictive, I should say, but eating, good healthy greens and a good mix and variety of food, engaging in hobbies, spending time with friends. There's lots of strategies that you can do at home as a first-line treatment too. So there's many books out there on things like cognitive behavioral therapy or acceptance and commitment therapy. These are researched, evidence-based treatments. And there's lots of books that are sort of walk you through the strategies that are used in those types of therapies. There's lots of meditation apps out there, mental health websites and apps, working with a virtual peer support group or doing online education like all of you are doing tonight with the National MS Society or Can Do. These are good ways to kind of start or kickstart managing your mood from home or getting some ideas to try. If you're really in having a more extreme mood and those healthy habits or home strategies really aren't doing it for you or aren't getting you to where you want to be, then you want to start seeking professional support. A starting place, as Pilar had mentioned, is going to your primary care provider or your neurologist and talking to them about how your mood has been. And then they might refer you to a psychologist or a therapist, or you can self-refer to those individuals as well. There are also therapist-led support groups that are a little bit different than a regular support group because they're more focused on educating and providing strategies for you to use at home. And there's also working with a psychiatrist who is the type of mental health provider who prescribes medication. Next slide. When to seek help. So Pilar talked about this in the very beginning, but I kind of want to hammer it home because I think this is very important. If you've tried those healthy habits and you've tried the home strategies and you're still feeling very anxious or low and those symptoms are getting in the way of your everyday life, that's when it's helpful to start seeking help. That isn't the only reason to seek help. There are times, so the Cleveland Clinic or the Mellon Center, they do a very brief 4-session intervention where they talk to people and they give them some coping strategies, even if they aren't having a diagnosable anxiety or depression, to teach them some coping strategies just so that they have them in their back pocket if they need them in the future. So that's certainly okay. But it's definitely worth seeking out treatment if your emotions are hurting your relationships, if they're getting in the ways of the things that you need to do or that you want to do or that you used to like doing, or if your emotions feel out of control, like you can't change them and it just feels overwhelming. Also, very important if you're having thoughts of suicide, it's important to seek help. That's kind of as a psychiatrist who works in MS, Dr. Adam Kaplan, he said it's kind of the angina or heart attack of the MS or the mental health world. That's when it's really important to work with a medical provider if you're having these kinds of consistent and persistent thoughts. I know right now it is extremely challenging in the post-COVID world to find a mental health provider. I've been hearing this from lots of people. And not every therapist treats every type of mood disorder, right? So there are some therapists who specialize in trauma. There are some therapists who specialize in working with health conditions, some who specialize in anxiety. And so it is helpful to kind of try to find the right provider, and it may take interviewing a few people or trying on a few different people before you find the right fit. There are lots of online directories out there. The American Psychological Association has a directory, and they also have specialty providers who work specifically in health psychology or neuropsychology or kind of things that are very specific to MS. Help Pro is another one that has some options that are specific to multiple sclerosis. Psychology Today has a chronic illness option that you can choose, and Find Empathy is providers who specialize in health psychology. The MS Society also has a navigator program where you can call them, chat, email, or just go on their website and click on Find Doctors and Resources, and they have a listing of different mental health providers around the country who have experience and expertise in multiple sclerosis. It's hard sometimes to find somebody who specializes in MS and also takes insurance. So I know that's a big, huge barrier. But sometimes if you call your insurance provider and ask for individuals who have knowledge or expertise in chronic illness, they may be able to help connect you with somebody that will accept your insurance. Also, most medical teams do have at least 1 or 2 people that they consistently work with. So, don't hesitate to ask your primary care provider or neurologist for a referral as well. And, many times when I've talked to individuals and I've asked them how they found me, they got those referrals from their friends. So, don't hesitate to reach out to your social community, your support groups, your church community, and ask if they have specific referrals, because there might be somebody that you wouldn't have found out about otherwise.
Mhm.
Next slide, please. So the key takeaways here are that there are normal fluctuations in mood, and not every challenging emotion is a depressive episode or an anxiety disorder. And so we don't want to overinterpret those symptoms, but if those symptoms start getting in the way of your everyday activities and your relationships, then they're important to pay attention to. And there are real strategies and ways that we can improve your mood. So if those at-home strategies don't work, for sure reach out to a therapist or a psychologist or a psychiatrist, and you can get some extra help.
So thank you, Megan and Pilar, for some great information this evening. Before we go into the Q&A, I do want to share some of the go-to strategies that the participants shared. One thing is, I don't know if you know this, Megan and Pilar, but they actually don't see the other people's
okay.
questions.
Yeah, there's so many good ones.
We've got some really great go-to strategies. We have gospel music, reading and laughing, watching TV, which is a really great go-to I love. And someone here says, I haven't figured out how to boost my mood quite yet. So I hope that this webinar has helped. Medication, and we did talk about medication. Playing games, nature look at the lake, puzzles, talking with friends, a combination of a lot of things. Cleaning, and I'm sure that the people in your household must enjoy that. Yoga, which is a favorite of mine. I do anything that helps me not think. Watch TV, play games, clean, paint, meditating in God's word, talking to sisters and friends, being with friends, which is great. We talked about that social aspect earlier. All of the above, plus resending textbooks from my bachelor's, perhaps her bachelor's degree. COVID has made this difficult. Waiting out the negative mood. Someone else plays guitar, listening to music, so going outside for a break. So really some great strategies that are go-to strategies for our participants. And as Megan and Pilar alluded to, it's talking to other people and sharing strategies that can be a great learning experience. So Megan, as we start the Q&A session, I'm going to stop sharing my screen right now. And we had a lot of people indicate that mood swings are a big issue. And so it's a two-part question. And the first part is, how do I deal with my own mood swings throughout the day? Do you have any strategies for that? And then the second part of the question, which is even just as important, is how do I help my support partner deal with my mood swings? And we haven't really focused on support partners throughout this conversation. So I'm going to throw that two-part question to you to start.
Sure. So I think so, as I kind of alluded to earlier, we both alluded to earlier when we talked about irritability and anger, I think mood swings are very similar in the sense that this is sort of the outward manifestation of some vulnerable emotions. So I would start to pay attention to what is triggering those. So that might be an event in your environment, that might be something that you're going to do that feels a little bit nervous. That might be a reaction to how you might be interpreting other people's reactions to you. So what's the vulnerable emotion? I tend to think sometimes, even for myself, when I notice myself reacting, there's usually something underneath of it. Like I feel like I am not doing good enough, or I am not, there's some vulnerable feeling underneath of that. And if you can start to identify those thoughts, or even just the environmental cues, then you can start to make shifts and changes. In terms of support partners, I would say, I wanted to also, since you said we didn't focus on support partners, when somebody in the house has a depressive episode or has a diagnosable anxiety disorder, support partners will also be impacted by that. And so I think, sometimes it's worth doing family therapy to sort of, how do we change the dynamics in the house so that it helps all of us feel better? Pilar, do you have additional thoughts?
Yeah. Well, one thought I had was emphasizing communication. Just the idea that your support partner can't read your mind, and unless you really verbalize how you're feeling and try to express it and help them understand what's going on, they might not really know or fully understand, or they might misinterpret what's going on. So if you look appear to be uninterested or unmotivated because you're feeling depressed, they might misinterpret that as you don't really care or you don't care about me, when that's not really what's going on at all. So I think that to the extent that you can, my recommendation would be to try to share and open up about what's going on, and even if one is not exactly sure how you're feeling, at least to share that that you are not feeling well, and so people, your partners might not personalize your behavior or your feelings, and think that there's something going on with them, or that you're mad at them. When that might not be the case.
So this question is about someone is coming from someone who has limited mobility. And so how do you get over, and I'm going to send this one to Pilar, how do you get over feeling like you're only existing and not living?
Okay, that's an excellent question. I think it ties into those feelings of loss that we were talking about. The fact that MS can take a lot out of your life, a lot of things that you value, and sometimes it's really hard to deal with those losses. Those losses are real, so it's really not just that you're being negative. There's really some real limitations there that have been brought about by the disease. One thought that I would have is, I think that even under those circumstances, I think that there's probably other things that are happening in your life, and sometimes our mood ends up being influenced by whatever we're focusing on. And what I mean by that is that if we're focusing in all the things that we have lost, it's more likely that we're going to end up with those feelings of grief. But if we can focus on what things we still have in our lives and things that we value in our lives, things that we can do, and that's what the organization tries to focus on, right? What are the things that we are still able to do instead of the things that we are not able to do? I think that can shift the mood a little bit. I also think that sometimes it helps to consciously make an effort to find some of those positive things that are happening in your life. I think, I don't know if some of you are familiar, there's a neuropsychologist, Rick Hansen, that talks about how our brain is, it can be like Velcro for negative experiences, but a Teflon for positives, so when something negative happens, we kind of grab it and we hold on to it and we focus on it. And when some good things happen in our lives, oh, that was nice, and Teflon is gone, right? So to consciously maybe pay more attention to the positive things that are already there, I think might help create a little bit more balance.
Megan, did you want to add anything before we go on to the next question?
Sure. Yeah. I mean, I think it's a great question. Was thinking of two things. One is sometimes I will do a values exercise with the people that I work with. So I will talk about the things that they are not able to do anymore, and really kind of figure out what was it about that thing that made it so meaningful and valuable. So, for example, if somebody really loves running, it might be that they liked being out in nature. It might be that they liked feeling the wind in their hair. It might be that it was exercise. It might be that they got their alone time while they were running, right? Um, and so if we can sort of pull apart what was valuable about that experiences, many times you can take that value or that thing that was so important and you can find it in a different way through something else. It doesn't mean that that other thing is not still a loss, but it might be that you could find that same underlying value in another way. I do that exercise, and I also tend to talk to people about kind of a two-pronged approach. There's time to grieve, and then there's time to problem solve. And you want to oscillate between those two things. So you maybe set aside some time for grief when those feelings show up, acknowledge them, live with them, cry, for a certain amount of time, and then shift to problem solving mode. And what is a way that I can get out of this, or do your gratitude journal, or all those kinds of things. But you want to kind of oscillate in and out of those two categories.
Mhm. Thanks, Megan. So Megan, going back to the common emotions that Pilar discussed earlier in the webinar, the question is, feeling like I no longer have anything to offer because of my MS, I'm experiencing all of those common emotions.
Hmm. Yeah, I think that's a really common experience for many people. And this is a hard one because I think a lot of it comes from the value that people put on our physical functioning or our cognitive functioning. And as Pilar was mentioning earlier, um, when those things are taken from us by MS, um, there are some real challenges in terms of being able to go certain places or having the right tools to help you, or even do I want to use those tools? And so I think that there needs to be not only kind of a challenge of finding out what we can still do, but sort of challenging those core beliefs that may be coming from the world around us that say that, if you have to use a tool, that means you're less valuable. Because I think that if you do some digging, there's lots of great research out there, and advocates who will talk to you about the importance of sort of kind of embracing those differences and recognizing the value that you bring to society and not believing those negative messages. So it's a little bit of sort of kind of shifting those underlying beliefs that you may not even have been aware that were there. I don't know if Pilar, you have other thoughts about that.
Yeah, I completely agree. I would just add that you are more than the roles that you play in your life. So I don't know if just to come up with a couple examples, if you can't drive, you can't go pick up your kids anymore. That doesn't make you less of a parent. Because you are not able to drive. The role of driver does not define you as a parent. And just there's many roles in your life that don't define you. They're just things you do or don't do, but they don't define who you are. Excuse me, or the value that you have as a person. But I do think that it is true that society tends to give these messages that make us believe that we are sort of the sum of all the things that we do, and all and when it's not really true.
Mhm.
So it looks like we are getting close to the end of the webinar, but I do want to ask a question about is depression higher in MS than other chronic illnesses?
Yes. The short answer is yes. It's It's even higher than several terminal illnesses like ALS. And so that's when Pilar was talking about that we can think about depression as both a reaction to the challenges, but also a symptom of MS itself. I think there's some pretty strong consensus that inflammation or changes in the brain do also trigger episodes of depression. I don't know if you wanted to add to that, Pilar.
Yeah, no, I agree. I agree completely. That is not, as I think I mentioned, is not necessarily associated with a level of disability, but there's definitely more to it. And that neurological piece, I think, is a critical piece. With depression end up being a symptom sometimes of the MS.
But the key part there too is that these behavioral strategies and antidepressants still work in MS, even if we think of that as a symptom of MS. Just because it may be associated with MS doesn't mean that these strategies don't still work.
Mm-hmm.
Fantastic. So thank you both very much. We had a lot of a lot of information this evening that you shared. The one thing I wanted to focus on before we conclude the webinar is, as Pilar said, focusing on what we can do. That's a philosophy here at Can Do MS. And so did you have any closing comments or strategies that you wanted to share with the group before we end tonight's webinar? I'll start with Pilar.
Yeah, just be mindful of what you're paying attention to, right? I tend to, in my way of working, I focus, I try to focus a little bit on how people think about things. And sometimes even if you're not able to change your own situation or what's happening with you, you might be able to work with the way you're thinking about it and to focus on the actual things that you're still able to do and accomplish.
And yeah, I guess my strategy too would be come to some of the coaching sessions and the opportunities where you can interact with other people that have MS. And I'm not just saying that because I'm on this webinar. I have truly found that when other individuals are able to share what's worked for them and also hear what's worked for others, you gain more tools for your toolbox. So you have a wealth of knowledge of people who come to these events you can share ideas with.
Mm-hmm. So thank you so much for joining us. Megan and Pilar, thank you for being with us tonight. I really appreciate all the information that you imparted to our participants. Thanks, Pilar. Thanks, Megan.
Thank you.
Thanks for having us.
Bye-bye.
And most of all, thank you for joining us tonight. To everyone out there, we very much appreciate you making Can Do your go-to place for community and connection. We look forward to seeing you at our next program. Have a great evening.